Hello everyone. Today we're going to talk about a slightly different topic. Typically, we record videos where we're talking about medical aspects of things. How is this surgery done? How is that procedure done? But today we wanted to talk about the psychological aspect of hair fall. Hair fall is something that can cause deep mental scars in patients, and that is something that is not recognized enough. And in particular, Dr. Venkat, who has been treating hair fall for over 2 decades, has a lot of insight in this, a lot of patient stories. And we want to make this video to tell our patients that you are not alone. There's no need for you to feel bad. There are treatments available. So I'm Dr. Aniketh Venkataram, plastic surgeon at the Venkat Center. This is Dr. Venkataram Mysore, dermatologist at the Venkat Center. Now, Dr. Venkat, in your 20 years experience with treating hair fall, how would you say that hair fall affects a patient psychologically?
See, the hairs or hair loss has an influence which is out of proportion to its importance to the body. When I say importance, I mean from importance from the point of health. Even if you lose all your hair, your body function will not be affected in any way. But slight hair loss, slight baldness causes a massive effect on the patient's psyche. Why is this so? Because the main function of hair is cosmetic. It enhances appearance. It boosts beauty. In fact, it is for this reason that it is often said the hair fall treatment is a kind of psychiatric treatment. Hair transplantation is a kind of psychiatric surgery. Hair transplantation is one of the best facelifts that people can get. It's the easiest way to give facelift. So, any problem concerning hair has an enormous influence on the mind.
Very well said. Now, there are two parts to this, in my opinion. One is how it affects the patient himself. Second is how society reacts to a person with hair fall. Lately, especially in the last few years, there has been a lot of sensitivity in terms of how we describe people. That we should not make fun of people for their skin color. We should not make fun of people for their weight. We should not make fun of people for their orientation. But somehow, it is still kind of okay to make fun of people for being bald. And this is something that I really don't understand. We make fun of people who are bald. We call them takla, we call them ganju, we call them motte. We don't do that for anything else. We don't make fun of fat people. We don't make fun of people with different skin color. But why do we still do this to men? For a condition that is not in their control. No one chooses to have hair fall. It is their genetics. There's nothing someone can do for their hair fall. And not just do we make fun of people for their hair fall, we make fun of them when they try to treat their hair fall. If they wear a wig, we make fun of them. Look at that fellow wearing that wig. If they grow their hair long and they do a comb over to hide it, we make fun of that. So not only are we making fun of the person for something he can't control, when he's trying to take steps to improve it, we make fun of that also. It's a very weird situation. And on the flip side, if for women, they can wear wigs just for fun and no one makes fun of them. You all remember the controversy at the Oscars where Will Smith slapped Chris Rock for making a fun of his wife being bald. I mean, you can say that he shouldn't have made that joke, which is well and good. But if that same joke was made about a man, there would not have been such a big reaction about it. Why this double standard? So this is the kind of issue that men with hair fall face, and people don't understand this. They just take it as a joke. And because of all this, there's a lot of things that happened to that person. Dr. Venkat will give you some examples of real life patient stories that he's seen during his long career, where people have suffered for their job, people have suffered to get married. It just holds them back in all their ways. So in the next segment, Dr. Venkat will talk about some real life patient instances.
I will now tell you some interactions with patients over the past 20-25 years. In fact, we have written 2 chapters on this in a textbook on mind, skin and hair. One chapter is with respect to skin, beauty and mind. Other chapter is with respect to skin, hair and mind. Now, I will not actually forget this one interaction which I had with the patient. Patient came, he had a hair transplant. After about 8-9 months, he came back very happy, beaming, smiling and said, "Sir, I have got excellent result. Thank you very much. I can now go and show my face to my father." I was surprised. I said, "What do you mean?" He said, "No, sir, I ran away from home and I have not gone home for nearly 3 years. I said, "Why?" He said, "Sir, when I was losing hair, everybody was making fun And when I wanted to treat, they wouldn't help me. And so I decided I will earn the money myself, get a transplant. So I left home 3 years back and I said I will come back only when I get here. Now I have got here. I am now going back to see my family. Now, whether he did right or wrong is a different issue. But look at the effect that patient mind underwent. Small little remark from somebody hurts patients, which we often don't realize. I'll give you another example. The mother brought a young person, 20, 21 years of age. He had diffuse thinning. He was not completely bald, he had thinning. You could make out that he is really balding. He was wearing a cap. Even in front of me, he was wearing a cap and he was not willing to take it off. And I had to examine him, so he showed me. I said, why are you so shy to remove the cap? You're a doctor. Then the mother said, sir, not only to you, he has never taken off the cap in the last 5-6 years. He has never shown his head to anybody. Even at home, he is always with the cap on. And if somebody comes home, he locks himself inside the room. I was again surprised. Why did it happen like this? He said, sir, I was always wearing cap because I was very conscious. People would make fun. And so I wear the cap so that nobody makes a fun. Then I said, why do you lock yourself in the room? He said, that's because once there was a marriage function, a lot of people had come home. And then I was sitting there with the cap on. One of my cousins took the cap off and everybody looked at my thinning scalp and everybody started laughing. That day I decided, since I can't prevent that kind of thing happening, I will not show myself to them at all. So last 5 years, he had not attended a function. He had not met anybody. Only family members, cap. If he went to school, cap. Did it have to be like this? Could it have been treated more easily? Definitely. He could have easily gone to a dermatologist, hair surgeon, trichologist with a proper qualification, and it could have been treated easily. We have enough treatments now to prevent this from happening. This is another instance. Third instance, again a young person of 22 years, 23 years, the son of an IAS officer. And when he came, I found out that he had 3 transplants by the age of 23. The first one was at 19, second one at 20, third one at 21. Now he has come for the 22nd, fourth one at 22. Every time it is receding, he is doing 500 grafts, 600 grafts like that. Why? Because number one, he doesn't like baldness. Number two, he cannot wait and tolerate even slight amount of thinning. He is obsessed with that. And number 3, he is afraid of taking medicines. This is not correct. Any hair loss management should include 2 parts: preserving existing hair, getting new hair. If you don't do it, you end up doing transplant year after year. And transplant is not an easy thing. First you plan for it, you think nearly 6 months, 1 year, then you get it done, you wait for 1 year, and then you think that you are losing hair. That means throughout your adulthood, young adulthood, between 20 to 30 or 35, you are spending it on hair only. This is not correct. One lady came. She actually was a friend's daughter. He called and said, I want transplantation for my daughter. I said, please come. And when I looked at her, she had excellent hair. I was surprised. Where to do transplantation to this young girl? Then I found out that patient had an obsessive disorder and had to be sent to a psychiatrist for proper treatment. So the mind is grossly affected by hair, and mind also affects the psyche and the thinking process and the treatments. Then looking at the other side, the positive side, one patient sent a photograph. Doc, I underwent transplant 9 months back. Previous to that, I hated looking myself in the mirror. Now, every time I look into the mirror, I remember you because you have changed my appearance. His face had changed. He was looking younger, he was happier, he had a smile on his face. So, absence of hair causes a deep problem. When you get hair, you also feel elated and joyful. Life changes. Hair transplant surgery is one of the truly appearance changing surgeries, which is extremely safe and can be done by almost everybody. So, my advice to everybody, do not be worried about hair loss. Do not be afraid of getting yourself treated. Whether it is medicines, whether it is biological treatments, whether it is transplantation, there are options for you. Newer and newer options are coming, and we are able to treat almost everybody now. This is the advice to the patients. The advice to their parents, relatives. Please try to understand him. Please empathize with him. Do not belittle him. Do not laugh at him. Do not make fun of his appearance.